joined by Mr. Prasad, that you know very well. We will be co-hosting this press conference. We are delighted to have with us the Honourable Minister and the officer in charge from WHO. They will be addressing and interacting with you.
Dear friends in the media, let me perhaps start with a few opening remarks. And I would like to say first how proud and happy I am to be here in Sri Lanka, because Sri Lanka has an impressive track record in health. Sri Lanka is known for its excellent primary health care system, for the progress made on maternal and child health. Now, it's a pleasure to address you at the occasion of the 78th Regional Committee session of WHO Southeast Asia. This regional committee is historic in a number of ways. Let me perhaps briefly outline for you some of the highlights that we witness here and are proud to be here for. First of all, today our Director General, Dr. Tedros, has handed over a certificate to Maldives and to the Maldives Minister of Health, validating the country for achieving triple elimination. Means the elimination of mother-to-child transmission for HIV, syphilis, and hepatitis B virus. Maldives has become the first country globally to achieve triple elimination, reflecting the country's commitment to universal health coverage and integrated high-quality care. So once again, this is a unique moment for the region to celebrate, and a first of globally. We also felicitated today Nepal for having eliminated rubella and Timor-Leste for eliminating malaria. Both are achievements from earlier this year, and today we handed over certificates. Second, we just concluded a ministerial roundtable and adopted the Colombo Declaration for Healthy Aging through Strengthened Primary Care. So, this again, once again, is thanks to the historic foresight of Sri Lanka in making this an important topic, because we expect to see a doubling of the aging population in WHO Southeast Asia by 2050. By then, 1 in 5 people in the region will be over 60 years of age. And so our ministers adopted this declaration and made very strong commitments to addressing a fulfilled life throughout the life course, and ensuring healthier aging and adding life to years, as we say. So congratulating Sri Lanka for its leadership. Then let me perhaps say that the regional committee will also focus on some of the key public health challenges that we face around the world. First of all, the member states will discuss a regional strategic framework to address the use of smokeless tobacco, electronic cigarettes, nicotine pouches, and areca nut. Why is this important? Because the region continues to bear a disproportionate burden of tobacco use despite some good progress that has been made. As you can see in our WHO Global Report on Trends in Prevalence of Tobacco Use 2000 to 2024, which was released last week, the region has made the fastest progress globally in reducing tobacco use. Having said this, with more than 322 million adults and 8.6 million adolescents in the region still using tobacco, there is much more progress that can be made and must be made. We know that tobacco use in the region remains the single most important modifiable risk factor for non-communicable diseases. And so reducing tobacco use means saving a lot of lives. Then, very briefly, we will also address in this regional committee session accelerating the action against antimicrobial resistance. This, again, is important because antimicrobial resistance is a major and urgent threat to global public health in our region and beyond. Furthermore, we will expand the Regional Health Emergency Fund, or CRF, and hope to receive some financial commitments from member states for this health emergency fund, which is being used to address acute health emergencies across the region, whether it's flooding, whether it's other extreme weather events, or whether it's health action required as a consequence of conflict. And perhaps last but not least, I want to say that we also launched at this regional committee the Regional Youth Council here in Colombo on Sunday, which will mean that youth will be much more engaged in our important work on health. Youth engagement is critical, to address health and well-being for the decades to come. So let me close by saying that the partnership with media is important to WHO in many ways, to address misinformation, to ensure that people get access to the right health information. And so I thank you for helping us to build trust between communities and healthcare systems, and helping us making sure that everybody out there understands the healthcare policies that are so much needed for us to achieve WHO's global health targets. I thank you.